KINECT-HD is a phase 3 randomized double-blind placebo-controlled trial studying the efficacy, safety, and tolerability of valbenazine in individuals with Huntington's disease-related chorea. This trial is being conducted by the Huntington Study Group in collaboration with the University of Rochester's Clinical Trials Coordination Center. The KINECT-HD study is sponsored by Neurocrine Biosciences, which is a neuroscience-focused biopharmaceutical company that discovered and developed valbenazine. Hi, my name is Erin Furst-Dimming, and I'm an associate professor in the Department of Neurology at the University of Texas Health Science Center at Houston McGovern Medical School. I am the principal investigator for the KINECT-HD study.
The main objective is to test whether or not chorea responds to valbenazine. It's a pretty straightforward question. And you might ask, well, why should we do this? I mean, why do we need another medication for chorea? I think, first off, I think it helps everyone to have more options. And I liken the idea of medication options to a painter's palette, where they can choose different colors, and we're able to individualize therapies for patients based on their needs when we have more options for patients. Hello, everybody. My name is Daniel Clausen. I'm at Vanderbilt University Medical Center in Nashville, Tennessee, and I'm delighted to join the team of the Huntington Study Group, my colleague and principal investigator, Erin Furst-Dimming, and the rest of the HSG sites to be a co-principal investigator for the KINECT-HD study. One of the objectives for this study is really to see how this medication works in a large population of Huntington's patients with chorea. I think there's another really interesting aspect of this study that's really different and sets the study apart from other studies, and that is that for the first time in Huntington's disease, you'll be able to really objectively measure motor symptom changes in response to therapy through using a wearable movement sensor. This changes the field. We're changing the way we're doing studies, where we'll be able to say, we're going to give you this sensor and we're going to monitor your movement over the trial. And at the end of the study, we'll be able to actually see how movement at home, going to the grocery store, in the case of COVID, maybe doing things more at home than going to the grocery store, but we'll be able to look at how movement changes over the course of the study. And I think that's a really novel and exciting objective for KINECT-HD.
So valbenazine, otherwise known as NBI 98854, is a selective orally active VMAT2 inhibitor developed by Neurocrine Biosciences. Valbenazine has already been approved by the FDA and was actually approved by the FDA in April of 2017 for the treatment of adults with Tardive Dyskinesia, or TD, under the trade name Ingrezza. Tardive dyskinesia is different, obviously, than Huntington's disease. This is a condition in which individuals have involuntary movement, so sort of similar to the chorea that individuals with HD have, but different in that generally Tardive dyskinesia occurs after exposure to a certain class of medications. There have been 27 clinical studies performed with valbenazine to date. So 16 of those studies were phase 1 studies in healthy subjects or special populations, for example, patients with impaired liver function or kidney function. 7 of those studies were phase 2 or 3 studies in subjects with tardive dyskinesia. And there have been 4 phase 1B or 2 studies in subjects with Tourette syndrome. 1 of those has been in adults, 2 of those studies have been in children and adolescents, and 1 has been in children, adolescents, and adults. So we know that, of course, there are potential side effects with every medication. In valbenazine's case, the most commonly reported side effects from the clinical trials that have been performed were drowsiness, tiredness, and sedation.
So how do you know if you're the right patient or right participant for KINECT, or how do you know if KINECT's the right trial for you? The key aspects of the inclusion criteria is first, your age. So your age is probably between 18 and 75. You have clear chorea that requires treatment, and that's something that you can talk about with your doctor to see if you have enough chorea. You got to be willing and able to comply with the study instructions. It's a lot of visits, so making sure that you are committed to it is important before you start.
So now I'd like to discuss a little bit about the study schedule for participants. It's a relatively short study. The study lasts approximately 18 weeks in duration, and this includes a screening period, a study drug period, and a follow-up period. Participants will need to attend 9 study visits throughout the study. The screening portion of the study will last up to 4 weeks, and then there's a 12-week dosing period, and eligible subjects will be randomized 1-to-1 to either receive valbenazine or placebo. And then there will be a final checkup after the study drug dosing period, 2 weeks after you've stopped the study drug or the placebo, or if you leave the study prematurely.
So KINECT-HD is going to take place in 46 study centers in the United States and Canada. So you have a lot of opportunities to find a center near you. How do you find that center? You can go to the Huntington Study Group website and find out the sites that are there. And you can even contact us at the Huntington Study Group and we can tell you the closest site to you. We're trying to get 120 patients in the study, and you can also find more information on the website called clinicaltrials.gov or www.kinect-hd.org.